what is this other health system doing that maybe I can be learning from. To me, one of the things I always learn is learn from good things and also learn from errors. So if I don't know what's out, I cannot learn from anyone's mistakes. I don't want to repeat them. So that's also part of the conversation.
Hello, this is Zach with the American Journal of Healthcare Strategy. Welcome to the Clinicians in Leadership podcast series, where we focus on empowering clinicians from bedside to boardroom. I'm joined today by Dr. Arturo Loaiza-Bonilla. Dr. Bonilla, why don't you just take a second to introduce yourself, tell us a little bit about you and your experience.
Sure. Thank you, Zach, for having me here. It's always a pleasure talk to you. So, yes, Arturo Loaiza-Bonilla. I'm a practicing medical oncologist. I'm the system-wide chief of hematology oncology at St. Luke's University Health Network. Also associate professor at Temple University, and the co-founder, chief medical officer of MassiveBio, which is a technology company focusing on AI. Very happy to share my experiences here and take your questions and see how we can collaborate further and bring more leaders to the fold, hopefully with with the work that you're doing.
Yes, yes. Well, I'm thrilled to have you on today, and I think you have a unique combination of experience in clinical, administrative, research, technological. You offer a unique combination of perspectives that not a lot of other individuals and have, and so I'm thrilled to have the chance to get to interact with you a little bit today and pick your brain on some things. And so one of the first questions I want to hear your perspective on is the role that clinicians play or should play in innovation and in shaping the future of healthcare and implementing changes. What role should clinicians and physicians play in shaping the future of healthcare?
Yes, the very important question, particularly at this time. What I always said, and other folks have said it: if you're not on the table, you're in the menu, right? You need to be part of the conversation because we've seen a lot of things happening in medicine. The number of administrative tasks has exploded, and there's technologies coming up that are helping us to be more efficient and focus on what we always were inspired to become, which was taking care of patients. But we as physicians were very risk averse. We're always in our little bubble of patient care, and we get satisfaction by taking care of those patients coming for help that we provided. But very seldomly we had the chance to get out of that box and make the decisions ourselves. And I always thought about it in an interesting way. So outside of our lives as physicians, we are parents, we are taking care of houses, we are building our future together, saving money, doing being administrators of the lives of many other folks. I help from Colombia, where I originally came from. And but we get into work and it's like, okay, no, I only do this tiny thing and everyone else makes decisions for me when I'm the one making a lot of decisions outside of my realm. So kind of like removing that, paternalistic approach to work and us being part of the equation and really having an impact where we're the end users, right? So we're the ones driving a lot of the things that are happening in the healthcare space. So we should definitely be part of it. And as leaders, as enthusiasts, as collaborators, and information seekers, is important for all of us to be.
Yeah. Well, and in an industry like the healthcare field that is exists for the patient and for the good of the patient, you want your individuals like your physicians and your other clinicians who have that patient centered perspective to be the ones that are implementing those changes and innovations because they are actively seeing those changes and understanding how those will impact the patient in a unique way. And so you've touched on this next question a little bit already, I want to hit on it just a little bit more about the barriers that prevent clinicians and physicians from being at the forefront of innovation. What are some of those barriers?
Yes, of course, everyone has different personalities, and but I did a master's in medical education precisely because I felt that no one really taught us as physicians to, drive our interests in the best way possible. So in adult learning, there's different ways for us to express, our abilities to the best possible way. And one of the things I've noticed, and I had that myself, but I had to overcome it, was that the fact that we are, because we're very risk averse, right? When we're physicians, we want to, or nurses, or everyone in the healthcare field, we're always playing on the safe side. We want to be playing for the safety of the patient, the safety of the health system. We are, kind of like in defensive mode, always trying to protect all the potential futures that may be adverse, and that makes us to also feel more comfortable in the confines of a tiny role, right? Like kind of like the, doing what we do because that's what drives us the single day. But the I mean, that's a nice approach and I appreciate it, but it also makes us blindfold to all the other things happening around us. So if I don't understand what's happening at the global level, if I cannot know what new technologies are coming, or how this change is going to impact not only me but my patients and the health system in the future, we won't be able to exert change, and then I will not be able to even to deliver the care that I'm intended to give in a comfort zone. So the key thing is we need to kind of remove that barrier from our eyes, and go and see, okay, what is this other health system doing that maybe I can be learning from. To me, one of the things I always learn is learn from good things and also learn from errors. So if I don't know what's out, I cannot learn from anyone's mistakes. I don't want to repeat them. So that's also part of the conversation.
Well, and I think you highlighted the balance that needs to take place of being safe and prioritizing safety while also being encouraged to innovate and make changes and increase our own education on how those changes can be made that ultimately better encourages safety for those patients and increases and encourages better patient outcomes. And so I'm curious to hear your perspective on what leaders can do within the healthcare system to kind of help break down those barriers and encourage clinicians to be at the forefront of innovation. What are some things that come to mind when you think of what someone in a leadership position can do to break down those barriers?
Yeah, so I think there's always this best practices approach where we think that we have already, done the right thing and we have it all well controlled. And that's like, I've been in different places. I've been in academia, right? Like a full blown academic, Ivy League approach. And I've been on the other side of the spectrum in terms of, private equity, 100% return investment, but also quality purposes, all patient centered with unlimited resources, and then community based, approaches where we are having restrained volumes and things that we need to focus on. And I'm also at the forefront of being an entrepreneur as well. So what I can do whatever I feel is possible. So I think what we need to learn here is getting outside of that box, as I mentioned, and realize that yes, we do things right, but there is an opportunity to maybe do things better always. Uh, Not just having one person making the decisions. I mean, of course, I don't want things to be a complete crazy consensus. I want the Amazon approach. If you have a pizza, the amount of people who can be there is what the most decision makers, and decisions have to be made done quickly and delivered it, but also without hesitation, as long as they have a purpose or a problem we're trying to solve. So focus on the problems or the bottlenecks that are driving things to a direction that you don't want it to be, or you want to accelerate it further, and then uh, you know do all your efforts into optimizing those workflows first, and then you can do that much better as you release those knots that are the biggest ones that are holding things from really unleashing. That's kind of like how I see things. Just so learn, cross pollinate, and learn from private industries, like they invested millions of dollars on doing that innovation side, and apply it to what is happening in your local environment.
Well, and you mentioned something that's fascinating, and I love the analogy of untying the knots that you can untie first, and fixing the problems that you can within your own role and position first, and then moving on to some bigger problems there. And not only in that are you fixing problems and improving workflow, but you're also increasing belief and respect within the team that you are going to get, that you're working with, that you're getting things done, and that you are moving the needle, and you're making decisions that are going to better them, and ultimately better the patient. And I imagine that goes a long way for anyone that is working with you as well. Pivoting a little bit, I want to talk about your experience with being the co-founder and medical director of MassiveBio, and the experience that has brought you. And I'm interested because you started that back in 2015, a number of years before AI in its last couple of years has kind of taken the world by storm, and is widely more becoming more and more used and more common practice. I'm interested, giving your expertise in AI and digital health, and the implementing new technology. How do you approach the challenge of building trust among patients, clinicians, researchers, other administrators, and the right reliability of artificial intelligence and the tools that it offers?
Yeah. So, and I appreciate that question. So Massive Bio, and it has an interesting name, is come from massive parallel sequencing, which was next generation sequencing. We were doing genomic testing for all patients at the time. I mean, it wasn't even done ubiquitously. It was done for a certain number of patients, but no one understood the results. Then massive parallel computing, which is basically AI. In the past was brute force, which was like just doing iterative process, and we're still kind of like recovering from the AI winter, now coming into the really Cambrian explosion of AI, and synthetic biology, which is like actually change in the biology of the cancer and hopefully become like a drug discovery and beyond. So I always try to see ahead of the game, but also focus on the problem at hand, kind of like piggybacking on what we just talked earlier. And is when you create trust and you create adoption by solving a problem that people actually have. Many technological solutions that we have seen in the space and also have been like interesting blunders. There are things that no people don't really need or use, or there will not be a use case right now, maybe in the future, or maybe never. But we can do now something, for example, for clinical trial matching, because it's a full automatable process. We have the data, we have the mobile phones, we have internet in many places, and we have models that allows us to optimize the data, extract information, and do matching, as long as we feed it with the expertise that we all have. So that was a way for us to overcome that major roadblock in cancer care and beyond, and show people in real time that this is something feasible, doable, and is scalable. Other solutions that are more complex, like using predictive analytics by looking at X-rays and kind of replacing complete workflows for radiology, is they're not ready for prime time. I think we need to focus on the augmented oncology or augmented medicine, where those tools are helping us to be better and more efficient. But also to increase adoption. I think when we had some prior conversations about it, is the fact that if we're saving time, effort, from doing these technology adoptions, then we reinvest that time, which is invaluable, into the patient experience, into decreasing physician burnout. So just because you're saving time doesn't mean you have to see more patients or do more things, or you nurse do more infusions because now you have more time because of this process. Let's focus on being humans, because the AI is helping us to become more efficient on that aspect, and be part of the equation. Without the human in the loop, without the end user being part of the whole discussion, that solution will never be adopted widely. It may be have a niche somewhere, but it will not have the adoption that is going to change the future for the better for delivery of healthcare.
I'm curious to hear your perspective on something else that given the innovation can occur rapidly. People are constantly coming up with the next big thing, the next thing that's going to fix an issue, fix a problem. So that process, that brainstorming, that innovation process can happen kind of quick. The regulatory reimbursement and adoption, and you mentioned best practices. It can take a bit for something that is starts off as innovation to become a best practice. How do you in your experience address the disparity between the rapid pace of innovation and innovation can have, and then the slower methodical pace that regulatory reimbursement and healthcare system adoption and can have? How do you address that disparity?
Yeah, and that's a really hard problem to crack depending on the use case that we're talking about here. The first thing is to show success stories that are focused on the market you are, talking to, right? So for, physicians, and regulatory is mostly about, tort regulation. Is this going to increase my liability or not? That's like an easy one to take. Make sure that you're safe, that there's no bias, that the solution is really focused on that. For the patient, is about safety and accuracy, and make sure that you're not widening disparities because of the algorithms or the solutions that you're putting together. And also, there's something called the digital divide, where people, certain populations don't have, the technology that you need to implement that solution. So it could be the best solution in the world, but if you don't have internet or a cell phone, or you don't have the literacy to access the phone, or because, my grandmother, she's plus 90 plus years old, she may not be willing to use the latest model of technology, right? So that's part of that. And for the regulatory aspect and institution wise, and particularly for payers, uh, you just need to start the conversation very early and make sure that um, the solution you're bringing, that it has a return investment, right? Because for an institution, it's a lot of implementation. So the people are done with, implementing things that are never going to be interoperable. They cannot work with a EMR, that they don't work with a workflow. So it has to be almost like a freemium approach, that you just test it and try it, and then you can expand. Doing in a partnership with collaboration. So always coming when you say, oh, Google is doing it with Dana Farber or MD Anderson or St. Luke's in the community, then things actually start to move. And the other thing is work with government from the beginning. So right now there's a lot of opportunity now with initiatives like ARPA-H, where they're bringing funds for really changing the future and making it more decentralized, technological driven. So I love that approach. I think we can infuse that ARPA-H approach across all the technology innovations we're doing, where we're hearing first what are the problems, how to solve them in a what we call the hub spoke approach, and then those spokes are actually bidding for that solution that they propose to be the issue. Then we're going to have much better support with the with government and other public partnerships that are working around.
Dr. Loaiza-Bonilla, you touched on another topic that I want to cover in this interview is the health disparities, and as innovation and new treatments and new processes come into place and become more adopted. I'm interested to hear how we can prevent innovation from furthering those health disparities. You mentioned, the digital divide, and there's other health disparities that are just common throughout the medical system. And so how can we ensure that there's equity in innovation and prevent innovation from increasing and furthering health disparities?
Yeah, and that's a major topic because we need technologies that are helping the whole humankind, right? So, and no matter where they implement it, they can be widely used. And as we're talking the US, the digital divide is a major thing, but also what we call the social determinants of health. So those are basically, we don't have a centralized health insurance system, which is okay. That's the idiosyncrasy of the United States. I'm all for it. I'm okay with that as long as people feel comfortable with that. We need to adapt. So having the opportunity for understand from those technology solutions or algorithms who are the ones at higher risk for being left out, right? We don't want necessarily that everyone needs to have the solution implemented because it may not work for everyone, but at least for the ones that had the most impact, we don't want them out of the discussion. So one of the things I always look into is like, okay, how are we assessing for rural communities, like because people could be in the middle of nowhere, they still may have insurance, they don't have access to the care that they need. So how do we get those decentralization processes so they can be delivered closer to them, either a clinical trial or a nurse for hospice or someone who needs help for support for medications or for treatments during a certain period of time. So the same way we're doing it for, like, there's Uber, there's Instacart, there is Amazon, tells you things metric wise. We can do the same, and that's all AI.
Mhm.
So, and they're already incorporating that. We need to have the same approach in healthcare, because we can really do it as long as we optimize for the things that we want these patients to be, getting the better experience from. So, at MassiveBio, we're doing it all the time for clinical trials and beyond. We're trying to decentralize everything, get patients what we call just-in-time activation, facilitating testing and all that stuff. With at St. Luke's, we have 15 hospitals across a very vast region in the Lehigh Valley, and also all going into New Jersey. So we are aligning all those efforts to make hub and spoke approaches as well. And any technology solution that we're bringing, we are having that conversation ahead of the game. So it's just deliberate approach to it, understanding those things so you are aware, and trying to find solutions. Of course, nothing is going to be perfect, but at least you're getting closer to that better approach than before.
Right. Well, and I think that I think that was a great answer, and I think that you also just highlighted the importance of having someone with the clinical experience that's part of that's at the table, not on the menu, to use the phrase that you used earlier. And as a result, they're able to keep the patient centered as they're seeking to find these solutions, and also better understand what their fellow clinicians and other clinical staff members are going through, and can help lead the innovation efforts in a lot of unique ways with their perspectives that they bring. And so, um, Dr. Loaiza-Bonilla, I just as we get ready to conclude the interview, I'm interested. You've mentioned looking ahead and staying on top of the field and learning and recognizing opportunities. What are some ways that healthcare leaders can stay on top of an ever changing and ever evolving in an innovating field? Because you've done that, and you've done that quite well. And so, do you have any insights for others who how they can kind of do what you have done in that regard?
Yeah. So first, understand your learning mode. Like some people are better, listening. So listening to podcasts. Some folks are better visually, so they, watch, YouTube or something that is specific to that, or going to conferences. Some others just like to read and stuff, and just get impact from, journals, and blogs and Substack and all those different approaches. So I learned my approach. I am a great, audiobook listener and podcast listener. So whenever I had the time when I'm driving, I optimize my time by doing so. I take also some time of my day to, read news that are focused on me. So I do a specific, Google alert searches for certain topics. I understand the places I want to hear from. So I go like, OpenAI, Google Gemini models, what's happening with Anthropic, what's happening with Perplexity, and just get myself kind of acquainted to all those things. And of course, go to my professional societies, and listen to what people in the industry, where they have unlimited resources, what they do, so you can adapt it to your own things, understanding the constraints that you have, so you can be much more worldly. And I get involved with organizations like NASCO. I'm in the government relations committee, so I understand what's happening at the nationwide level. You have a lot of exposures like the FDA and CMS, and also work with my state society locally. So I work with PISO, with the state society. I'm past president, so I talk to my colleagues across the state and understand what they're going for, and also foster collaboration, because at the end of the day, we're all humans. There may be health systems that are competing against each other, but we as humans don't we're in the same mission to make it better for ourselves and our families and our nation. So that's what I wanted to focus on, looking at the future ahead of us.
Yeah, well, and I just I loved how you finished with we are all humans and we must collaborate. There's no one individual that can make a change that's going to extend beyond that make a substantial change that's going to truly impact the healthcare system, that a group of individuals can't make a bigger change. And so I I think that's a beautiful thing, that we must work together. It can be hard, but I'm glad that there's individuals like you that are encouraging and promoting collaboration and innovation in the ways that you are. So, Dr. Loaiza-Bonilla, I appreciate your time today. Thank you for coming on, and we hope you have a great rest of your day. Thank you, sir.
Thank you. Nice to see you.